Hello, Dr. Bavani Naidu here. I'll be presenting on the knowledge, perception and willingness to pay for umbilical cord blood banking, a pilot study. This would be the outline of the presentation: introduction, methodology, results, discussion, conclusion and references. Umbilical cord blood was once only a waste product that was disposed after the birth of a baby. After the first successful transplantation in 1988, some parents have developed interest in seeking information regarding the umbilical cord blood banking. Umbilical cord blood banking is a potential source of hematopoietic and progenitor cells in comparison to the other source of stem cells, which are from the bone marrow and peripheral blood, which can be used to cure children and adults from malignant, non-malignant, other familial or genetical diseases. Since 1988, after the successful umbilical cord transplantation in Paris, the use of cord blood stem cells has raised. The use of this alternative hematopoietic source has many advantages for donors and the recipient too. Advantages of cord blood, such as the prompt availabilities, the donors are free from the risk of anesthesia and low risk of transmissible infection and lower risk of post-transplant immune response, an easy manner of collection with little risk to mother or newborn. There are two types of bank, which is the public bank and also the private bank. The public bank, which collects donated cord blood for research or use by anyone who may need it, whereas the private bank stores cord blood for personal use by the family, and there is a fee associated with this service. Statement of problem. Till today, there are no much survey or data compilation on the knowledge or perception towards umbilical cord blood banking, particularly among the Malaysian society. And this study is designed to determine a small population of Malaysia's knowledge and perception about umbilical cord blood banking. And there's lack of research and policymakers in considering how this new technology on cord blood banking could contribute in improving health. The research questions would be: what is the level of awareness amongst the Malaysian pregnant women regarding cord blood banking? What is their perception on cord blood banking? And what is their willingness to pay for cord blood banking? The main objective of this study was to ascertain the knowledge and perception for umbilical cord blood banking among Malaysian pregnant women, and the study would also assess the willingness to pay for cord blood banking among the Malaysian pregnant women. And the significance of the study is that in this study, the level of awareness and willingness to pay among the Malaysian pregnant women on cord blood banking will be studied. And if awareness among the Malaysian pregnant women could be established, the cord blood can serve for the purpose of treatment as well for future emerging research and clinical trial. Awareness among Malaysian pregnant women with better knowledge and understanding about cord blood banking would help to identify the reasons for the lack of motivation to donate umbilical cord blood, and this study would also allow the experts to establish better recruitment campaigns in future. The research methodology: the study was a cross-sectional survey with questionnaire, and 6 months was the time frame. And ethical issue wise, there was a clearance sent an ethical committee for ethical clearance, and sample size was not based on statistical but on a pragmatic approach. For the scope of the study, the aim was to recruit at least 100 participants, and the study location was the Mom and Baby Expo in October 2014, which was held in the Mid-Valley exhibition, and the sampling method was based on the inclusion and exclusion criteria. And the inclusion criteria were pregnant women, Malaysians only, English literate, and limited to pregnant women who visited the Mom and Baby Expo in October 2014, which was held in the Mid-Valley Exhibition Center. And the data collection method was actually pregnant women who visited the study location for shopping or visit were identified and screened based on the inclusion-exclusion criteria. Patients who fulfilled the inclusion and exclusion criteria were informed about the study, and if they consented, then patient information form and case report form to be filled. Questionnaire consists of questions: 9 questions regarding demographics, 10 questions on assessing knowledge and awareness, 14 questions to understand perception on cord blood banking, and 4 questions to study the willingness to pay for cord blood banking. And data analysis was done using SPSS version 21. The results that we obtained: demographically, age the most were around 18 to 25 years old, whereas most of the education level were tertiary, highest was 68%, and employment status wise, most of them were from the private sector employees, and stage of pregnancy, most of them were in the first trimester, Whereas personal income, the highest percentage was with the income of 4,000 to 6,000 a month. And whereas for household monthly income, the highest were around RM 5,000 to 10,000, RM 40%. And from number of children, most of them were carrying their first child. And awareness and knowledge wise, have you heard of umbilical cord plunking? 76% of respondents who are mostly well educated had some knowledge of umbilical cord plunking. Benefits of cord blood banking as future treatment. In your opinion, what are possible benefits of cord blood banking? You may choose more than one answer, and only 10% of respondents were unaware of the benefits of cord blood banking in the future. When they were questioned about adequacy of cord blood banking awareness services, the question was, do you think awareness campaign to heighten public's knowledge on cord blood banking adequate in Malaysia? 48% agreed that the awareness campaign concerning cord blood banking is limited. Whereas when they were questioned about the source of awareness, the question was, how did you get to know about cord blood banking? 54% of respondents agreed that most of the information about cord blood banking were obtained from medical healthcare professionals. And whereas when the knowledge level was tested, the question was, how do you rate your level of knowledge on cord blood banking? 36% had little knowledge and 3% had strong knowledge. Main obstruction in dissemination of knowledge. In your opinion, what is the main obstruction in dissemination of knowledge? 36% was language barrier, whereas 34% was the education gap, and 3% was others. Previously stopped child's or children's umbilical cord blood, 93% said no. And when they were questioned of relative or friends had previously benefited from cord blood banking or stem cell therapy, 53% said no and only 10% said yes. Further questioning on perception, necessity to store umbilical cord blood. The question was, do you think it's necessary to store umbilical cord blood? And 41% said no. And the reason they choose not to store umbilical cord blood, most of them, 68% said it was expensive, 17% said unsure if child or family would really need it. Necessity to store cord blood of all your children. When they were the question was, do you think it's necessary to store cord blood for all your children? The percentage of 44% said no, and only 25% said yes, and 31% were unsure. Cord blood harmfulness to either mother or the baby. 73% were sure that it has no harms, and 24% were unsure. Individuals whom benefit the most from stored cord blood, most of them said the baby itself. Cord blood bank preference, most of them, 68% were unsure, and only 21% said private bank. Cord blood bank preference after reading scenario and benefit of cord blood banking. The scenario was, public bank collects donated cord blood for research or for use by public who may need it. There is usually no charge associated with this service, and they are available in Hospital Kuala Lumpur or UMMC, University Malaya Medical Center. However, private banks store cord blood for personal use of the family. The service is provided at a fee by companies such as Cryocord or Stem Life. 26% were unsure and 41% said yes. Cord blood bank preference after reading the scenario. 63% said they would opt for public bank. The reason for donation for storage in the public bank, most of them chose, 69% of them said it's too costly to store in privately. Reasons for donation for storage in the private bank would be 40% said for better storage condition, whereas 20% said and avoid the guilt of overlooking the storage of cord blood if in case there's need in future. When assessing on willingness to pay, intention to pay the fees for cord blood storage after reading from table. In a preliminary market survey, cord blood banking would cost approximately RM3,000 for single delivery and a yearly storage payment of RM250, whereas for twin delivery, approximately RM4,000 and yearly fees of 500. And 50% said no, they are not willing to pay. And price that can be paid, the fees of cord blood storage, 80% said RM500 to 2,000 ringgit. And the discussion. Most participants who came for Expo were in the age group of 18 years old to 25 years old with good education background, and they are aware of the good deals that can expect from for their future baby from the expo. And respondents with good income were actually they did not mind paying for the future of their children, and high education background make them curious and keen to explore more knowledge concerning umbilical cord blood banking. Most of them were from the first and second trimester of their pregnancy, because pregnancy probably is not too big and they won't feel tired shopping in the expo. And most of the respondents were not carrying their first child, therefore they are well experienced and good branded baby products can be obtained from the expo for a reasonable price. And pregnant women participated have heard about umbilical cord plucking probably due to their good education background, which they could have attained from reading magazines, browsing the net, or communication with their family and friends. Stem cells which are found in umbilical cord blood seems to be beneficial to treat diseases such as diabetes mellitus, malignancy, heart-related disease, osteoarthritis, and many more, but they are still on study and clinical trials. Therefore, public are skeptical and would prefer evidence-based knowledge would be beneficial, especially among the educated group. And most of the pregnant women and their partners gain knowledge from their medical healthcare professionals during their antenatal checkups and prior to delivery. Medical healthcare professionals are most reliable personnel in educating pregnant mothers and soon-to-be parents with unbiased explanation regarding cord blood and stem cells. Private bank organizes campaign, especially in mother and baby expos, to advertise and also advertise in parenting magazines to disseminate regarding their private banking, whereas there's no much information regarding public bank. Level of knowledge correlates with education. Postgraduate respondents had good and strong knowledge, remaining postgraduates and tertiary educated respondents had little or some knowledge concerning umbilical cord blood banking. And the main obstruction was language barrier. Usage of sophisticated or medical jargons should be avoided. Simple language could overcome this language barrier. Perception of participants in this study, similar to the research conducted in Italy by Parco et al. In 2013, showed that low economic situation and poor knowledge and language barrier in understanding about actually hindered the population from choosing cord blood banking. And good understanding among the public regarding the collection method of cord blood. There's a good understanding, and the painless method should be explained as it would motivate them to stop. And the advantage of using patient's own cell is that there is no risk of autoimmune rejection. Low chances of siblings and family members facing autoimmune rejection compared to anonymous donors, and parents might feel being biased by storing only one child's cord blood and feel guilty if they store one child's blood and when the other sibling in need and it does not match. Parents can opt for storing in public bank as it would increase the donors pool and possibility of matching would be higher when there's increased availability. Own stored stem cells will not be able to cure as the stored stem cells carries the same disease or genetics. Example in leukemia. Recent studies suggested that using own cord blood will not be an effective treatment as the precursor of the cancer are present in the stored cord blood. Siblings' cord blood could be beneficial but remains a doubt when considering match and autoimmune rejection. Parents should not have unrealistic hope. They should know the possibilities of autoimmune rejections, genetic disorders, and other pitfalls. Explanation should be given unbiasedly. Public tends to assume that if cord blood is collected from their child and reserved, it would certainly be compatible and could be definitely transplanted. Whereas cord blood from anonymous donor may not be suitable at all. After a brief explanation regarding the costs and functions of public and private bank of umbilical cord blood banking, most of them prefer public bank, mainly due to the price. And some opt private banking, assuming only private bank offers better storage methods and are more highly equipped, and worry that public bank may give an easy access to their cord blood and can be misused. Public banks should organize campaigns around as done by the private banks in order to explain their services, and economic background and financial status remains as a major factor hindering public from opting for private cord blood banking. Public banks can be used to store cord blood in view of economic constraints, and it could benefit for own use. Everyone in need could be helpful for future studies as well. Some of the respondents also thought that public bank storage would be beneficial for others and also for research use instead of private banking. And most of the respondents willing to pay between the range of 500 till RM1000, as with more children they plan for future savings and need as well. In conclusion, the younger generations of Malaysians is well educated with good monthly and household income, and they are aware of cord blood banking. Awareness is present, but detailed knowledge and exact benefits and advantages are poor and misleading them. Perception concerning umbilical cord blood should be improvised, and this can be attained with good knowledge on cord blood banking. And willingness to pay is restricted despite good income. Therefore, more experiments and clinical trials should be carried out to ensure safe and beneficial use of stem cells, which are abundantly found in cord blood. The limitation of this study was larger group studies should be used instead of only limiting among pregnant women, and large sample size should be used so that the results are more reliable, and stratified sample studying would be helpful for a greater precision. And the recommendations would be midwives, nurses, and breastfeeding advocates should educate the future parents regarding cord blood banking. Health clinics and Clinic Satu Malaysia as well should play their role in educating the public. Mass media such as the internet, magazines, newspapers, television, radios should play a role in advertising and educating the public. And there should be campaigns carried out in the government and also non-government organizations. And there should be a reduction in the cost of umbilical cord blood banking, collection and preservation, and where when the cost is reduced, this could motivate the public to stock cord blood. These are the reference for the study used.